How do we describe frailty severity to others? And this is for non-clinical staff and for non-expert clinical staff. So we can use this thing called the Rockwood Frailty Scale, or CFS for short. The Rockwood Frailty Scale, this is a simple tool used to describe how independent or vulnerable somebody is based on everyday life. It's not a test, it's not a diagnosis, and it's not a judgment, but it's a shared language to help understand what the support needs of an individual person is and helps us communicate between each other. This is how it looks, and it's pretty clinical in appearance, and the language used is something that perhaps can be quite difficult for others to think about using. So let's break it down and make it simpler. So when we think about how frail older people are, we can think about how difficult it is for them to manage in their everyday life in terms of independence. The clinical frailty scale here, more simplified, shows you really between frailty scales 1 to 3, you're pretty fit, and the best being number 1. By clinical frailty scale 4, you're starting to expose some vulnerabilities, perhaps getting slow and tired. By CFS 5, you're becoming mildly frail and beginning to find it a little bit difficult to do things like transport or housework. By CFS 6, you're moderately frail, and now you're beginning to need a lot more help outside your house, sometimes with housekeeping, and you may be needing a bit of help with the bath. By CFS 7, you're severely frail. This means you need help with everything, including your personal care like washing, dressing, toileting. By CFS 8, you are similarly frail to 7, but you are probably approaching the latter phases of your life. And even any minor stressor, such as a small infection, constipation, may well be difficult to recover from. And the last is CFS 9, which we tend to use less often, but is used to describe those people in the end of life who perhaps are otherwise not severely frail. So, for example, somebody dying from an advanced cancer. The key rule when thinking about using the clinical frailty scale to describe a person is to think, apply it to what that human being is like on their usual day, not on a bad day. So for non-clinical staff and non-expert clinical staff, how would you use the clinical frailty scale? I think you use it when you've noticed frailty. You use it to help you frame in your mind and explain and share how frail the person you're talking about is, which will then enable you and your supporting teams and structures to act early, to support people who are frail or at risk of frailty to age well by being much more proactive.